Hello everybody, this is Dr. Mario Martinez, also known as House Shrink. So today I have a very important topics that I'm going to be covering, and I'm going to wait a bit till people start coming in so I don't have to repeat it so many times. So welcome, and as soon as everybody starts exploding into the chat, then I'll talk about the subject. So as you know, anytime that I do these sessions or chats, have thousands of people that join, so it's really a good venue and a good audience. A lot of people are repeats here. They come on anytime that I'm on because I talk about good psychological things. And so what I ask is, if you just join us, make sure that you follow the channel and that you share the video. And as you know, it'll be available tomorrow on my YouTube channel under Dr. Mario Martinez. So, welcome everybody. And today, I'll repeat it a few times. I'm going to be talking all about phobias, anxiety, and OCD. So, that's the topic for today. Been a lot of questions, a lot of requests to talk about what anxiety is, what a phobia is, what obsessive-compulsive disorder is, and what you can do about it. But I have to tell you that I'm not going to be doing therapy here, so don't ask me for specific things because I can't do therapy here. I'm a licensed clinical psychologist, and it's unethical for me to give advice if I don't know you, if you're not my patient. So what I want to do is I want to let you know that there are three kinds of people that distract us, and those of you who have just joined and that follow me know about it. They're the clowns, the people that try to be funny and try to distract. Those people don't respect you and don't respect me. They will be given a clown warning, call it clown warning, and if they keep going, then they'll be muted. The second people that are distracting are what I call the emotional vampires. And these are the people that come in with mean statements and nasty kinds of things. Those people are given one chance, and if they do it again, then they are blocked. So just be aware. And the third are the ones that come here to give advice. Although it may be very well-meaning, I'm talking about some issues here that have to do with clinical psychology, so I don't want anybody to give advice on your own way of doing things because that's not what I'm here for. So just be aware. And try not to put on too many things that are distracting. For example, don't keep repeating things because then we're going to have to mute you or block you. Because why am I doing this? Because I'm taking my time. I'm a licensed clinical psychologist. I'm not charging for this. I'm here to meet some needs that people have. So the least you can do is to either don't join me if you want to play games, or join me and learn something. So just be aware of that. And then if you do that, then you'll get a lot of good information here. So if you just join, I'm asking you to follow the channel if you're finding this helpful, and then also share the video with other people. So today I'm going to be talking about is anxiety, phobias, and OCD. So that's what I'm doing here. So it's more like a lecture. And if you have specific general questions, I'll try to answer them for you. But I can't give you specific therapeutic advice because I don't know you, and it would not be possible. It would be unethical for me to do that. So I can give you general ideas so you can learn more about... hi, Derek, just joined. Thank you. Again, clown warning. If you come in with distracting ideas, you're going to be given a warning, and then you will be blocked if you do it again. If you want to be serious, then you're welcome. But if you want to play games and you want to distract people and be a clown, then we don't need you here. Does anxiety cause overactive bladder? It can, yes, because one of the symptoms is that you go to the bathroom, you urinate frequently. That's anxiety. It's one of the symptoms. So I'll be talking about first anxiety, then I'm going to talk about phobias, and I'm going to talk about obsessive-compulsive disorder, OCD. And they're different, and they have different ways. Also, what is the usual treatment, and what can be done about it. For more information, you can go to my website at biocognitive.com, which is on my page here on House Shrink. And you can also read my books, which are 2 bestsellers I have on Amazon and everywhere else, but Amazon's the best place. And then it's the Mind-Body Code and the Mind-Body Self. Does social media affect anxiety and depression? Yes, social media can be very distracting, especially if it's negative things. And if you're depressed, it can make you more depressed. Or if you're anxious, it can create more hyperactivity. So, Jeremy, welcome everybody here that are coming in, and serious people. We have a really good crowd of people, a huge group of people. But what I ask you is that I want you to please follow the channel, House Shrink, and share the video. And you'll always be able to watch this video tomorrow completely on my other social media, which is on YouTube, Dr. Mario Martinez. So the subject for today that has been asked many, many times, and I promised that I was going to talk about it, and here I am. I'm going to talk about anxiety, phobias, and obsessive-compulsive disorder. Okay? So this is what we'll start with. Anxiety first. Anxiety. What is anxiety? Anxiety is an overreaction. It can be a functional anxiety, or it could be a dysfunctional anxiety, which is more like a generalized anxiety. But what happens with anxiety is the activity of the brain increases. You secrete stress hormones, and it can be a functional anxiety, which means that it has a function, that you see someone coming to you with a knife. Well, that can make you anxious, and that can certainly put you on a fight or flight. When you go on a fight or flight, you begin to secrete stress hormones, which are necessary to fight or to flight. And then when that happens, your immune system suppresses. The immune system stops functioning fully because it's more important to fight or flight than to fight pathogens and other kinds of things. And that's good, because if it's a functional anxiety, a reactive anxiety, it's good. But if you have what's called a generalized anxiety, which means that you're in general anxious about the world and anxious about doing things, then that is a problem. And that's what's called a generalized anxiety or dysfunctional anxiety. So anyway, that's what it is. And what happens is that when you have that dysfunctional anxiety, which is the one I'll be talking about more, it requires help, because there's some neurotransmitters in the brain that are overactive, and it requires therapy, in some cases medication. But one thing I want to say about medication: the anxiolytics, which are the medication for anxiety, were made to work for a short period of time so that you could slow down the activity of the brain and have some psychotherapy and meditation and all these other things. Long periods of time, it causes very strong dependence and also addiction. Some of them, most of them will cause addiction, but some of them, or most of them, will cause a dependence. Even if it's not an addiction, you depend on it. So you have to be aware of that. But this is something that you need to decide with your professional healthcare person or mental health. I can't give you advice on that. But I can tell you that they were made for short-term use. Now, what happens with a dysfunctional anxiety? It was learned. There's a little bit of genetics. There's a predisposition to be more anxious, but it's mostly learned. You learn to look at the world in a hyperactive way, hyper-alarm way, that things are not going well. So you're functioning as if you're on high speed, car on high speed all the time, although it doesn't need to be. And it can be very devastating, because anxiety causes dysfunction and disorganization of the brain, and it affects your memory, it affects your focus, it makes you want to do things quickly, and it makes you more accident prone. So a lot of things are happening. So I'll be talking about treatment in a minute, about what natural ways to without medication. I'll be talking about it in a minute. But let me finish on the anxiety, why is sleep important? Well, one of the things that anxiety, especially dysfunctional or generalized anxiety, affects is your sleep. And sleep is important because that's when you repair. You secrete human growth hormones, which are necessary for tissue growth and for the immune system to do the repair, and also to be able to rest the system. How to get rid of healthy anxiety? Healthy anxiety, by definition, is healthy. And that's what I'm talking about. Healthy anxiety means you get anxious about things that make sense to get anxious about. A real danger out there, you have to get anxious. You're not a robot that just sits there, oh, here's a guy coming with a knife. No, you get anxious. and you have a reaction. You begin to then, you begin to have more activity of the neurotransmitters of the brain. Your heart rate goes up, your stress hormones go up, your blood pressure goes up, your pupils dilate to get you ready. But once that's over, then you have to go back and go back to normal. If you don't, then you continue. And one of the things to not try to perpetuate the anxiety is when something happens, deal with it, get rid of it, but don't go out and tell people, guess what happened? This guy got in front of me today and he almost caused an accident. If you do that, what will happen is that you're, again, shooting up all the anxiety were there, or as the stressor were there. Why? Because the brain doesn't know the difference. You say, okay, I'm talking about something. You already have memory of what happened with, let's say, somebody getting in front of you or somebody pushing you or whatever. The best thing to do, deal with it and let it go. Don't try to ruminate about it and talk to other people about it, because they love it. They love to talk about misery, but it's going to create a sense of anxiety about the world. So that's very important. Now, the treatment for anxiety, I'm talking about the generalized anxiety. Healthy anxiety, reactive anxiety is necessary. That's what human beings are needing. But the treatment for the generalized anxiety, first is that psychotherapy is very important to teach you, and you learn where it came from. Some meditation techniques, Tai Chi, exercise, food that are low in sugar, foods that reduce your hyperactivity. A lot of children have hyperactivity and attention deficit disorders related to the food they eat. They eat a lot of junk. They eat a lot of empty carbohydrates and sugars that what it does is speeds up the system. So that's one of the ways. Cognitive behavioral therapy is best. But the best, I think, is, of course, what I do, which is my theory of biocognitive science, which looks at mind, body in a cultural context. So in my books, I teach how to deal with it, the mind-body code, the mind-body self. Some doctors will use, a psychiatrist will use some medication, and it's appropriate in some cases. And the medication is usually a benzodiazepine or things like Valium and Atarax, and then also Klonopin, different kinds. And what they usually do, they're muscle relaxants, but they also set up the brain chemistry so GABA goes up, G-A-B-A, which is a neurotransmitter that when it goes up, it reduces the activity of the brain, and you begin to slow down. And GABA is a gamma butyric acid. GABA is and actually GABA can be increased by deep meditation. It can be increased by Tai Chi, some types of relaxing yoga, and so forth. The vaccine, unfortunately, I don't want to talk about it because there's got a lot of political issues there, and that's something that you need to discuss with your doctor or your healthcare professional. I'd rather do that, and of course, I'd rather not talk about religion or politics. Is meditation good? Yes, meditation is very good, but it helps tremendously, because what happens when you're working out, when you're doing, for example, walks, when you're doing special, when you do, for example, power walks like what I do every day, what that does is it increases endorphins, it increases GABA, it reduces the stress hormones, it brings cortisol down, all the good things that are needed in order to reduce the hyper alarm that's created by anxiety. Okay, so if you just joined, I'm talking about anxiety, phobias, and obsessive-compulsive disorder, or OCD. So what can help to calm an overactive bladder? Well, part of it, you have to talk to your doctor, because I don't know your situation, but one of the things that helps is that if you use your bladder frequently, it might be related to anxiety, because anxiety causes you to go to the bathroom more frequently, to urinate more frequently. Yes, too much medication can cause serotonin syndrome. That's right. But this is something that you need to discuss with your professionals. But there is some kind of overuse of serotonin medication, like antidepressants and so forth, that's called the serotonin syndrome, which has some kind of brain dysfunction from the research. But that needs to be discussed with your professional. Okay. Thoughts on Alexander the Great? I'm going to let you get by with this one, and then if you do it again, you'll be gone. Alexander the Great, let me tell you a little bit about it, although he's not part of the deal. Alexander the Great was Aristotle's student, and he conquered most of what the world was at the time, and he died very young of an illness, and they think that it may have been some kind of a poisoning, so it's not very clear. So he was Aristotle's favorite student. Okay, now when Alexander the Great died, who was from Macedonia, there was a lot of ill feelings about Macedonia, and Aristotle was from Macedonia, so he was forced to either kill himself like Socrates did, or to exile. And he left, and he died about a year later. So that's so much about about Alexander the Great. So read my books, because I have a lot of techniques there, and they are the Mind-Body Code and the Mind-Body Self, and you can go to Amazon right now, you can get them. So they'll be available there. But make sure that you follow. We have a lot of people today. We're going to have thousands of people today, so I'm really glad. And so follow, and then also share the channel, House Shrink, and of course, if you want to get the book, that would be great. All right, now I'm going to move on to phobias, and then we'll come back. We're going to move to phobias. Phobia, I would say that phobia, the best way to describe it is such a high level of anxiety that it becomes dysfunctional. But it's anxiety with great fear. So phobia has to do with fear, and you could have a fear of heights. You could have fear, agoraphobia of new open spaces, or acrophobia of altitude. And those, when it's a phobia, it's incapacitating, meaning that if you have a phobia, it'll interfere with your normal life. If you have a phobia of meeting strangers, you'll avoid strangers. Or a phobia of high places, you will avoid going up to high places. So it has a very incapacitating effect. And phobias are also treated with some learning techniques. Sometimes they use medications, but let me tell you, no medication cures anxiety, phobias, or OCD. They don't cure it. They help with psychotherapy. It's very important to know that. But it has to be done. Yeah, it is so draining. It's very draining. Phobias are very draining. So my research has been on phobias and how to deal with them, and I worked with both classical and social phobias. The social phobias have to do with people, like for example, fear of talking in public, fear of making mistakes, those kind of things. And the classical phobias are fear of snakes, fear of spiders, fear of height, fear of claustrophobias that have nothing to do with the socializing, but more with things and context. So those are the phobias. And phobias are very incapacitating, but good therapy has excellent prognosis for anxiety and for phobias. These were learned processes. You taught the nervous system something, and this can be taught. How about phobias about COVID? Yes, of course. No, but here's what you have to be aware. You could have a healthy anxiety if you're working in a hospital, which is good, being careful, not being close to a lot of people, wearing a mask, taking zinc and a lot of vitamin C. That is a natural protection. But if you have a phobia, for example, you can't go to work because of COVID, then it becomes a phobia, and you have to deal with it. You have to get some professional help. So anyway, that's the idea of the phobia. So let me stop now and give you a chance to ask about phobias and anxieties before I go to OCD. Okay? And I'll drink a little. I'm drinking some aloe vera juice, very healthy. But make sure that while I'm waiting for your questions, that if you just joined, I'm talking about phobias, anxiety, and OCD. And what I ask you to do is to please follow the host and share the video. And tomorrow you can watch this whole video on my YouTube channel, Dr. Mario Martinez. Mental Health Warrior, you just follow the host. Thank you very much and welcome. Matt, everybody, follow the host. Okay, so questions on phobias, and let's see. What if you never had traumatic experience but still have phobias? You don't have to have a traumatic experience for a phobia. Sometimes they're learned by something that you don't even remember when you were a little kid, or sometimes even by having a bad dream. Okay, pronouns. Let me tell you about pronouns. I'm not interested in pronouns. I'm interested in character. So don't ask me for pronouns. Pronouns are meaningless to me. What matters is the character of the person, how honest you are, how compassionate you are, how willing you are to admit that you're wrong. Those are the things that are important. So don't ask me pronouns because I'm not interested in that. I have some articles and some videos on pronouns to see how distracting they are from character. So it's not any prejudice about pronouns. I just want you to focus on character and not on pronouns, at least here. It's difference between severe anxiety and OCD. Let's wait till I get to OCD so I can explain it further. I'm now on with the phobias and with the anxieties, and I'll talk about OCD. Phobia and paranoia. Okay, that's a really good question. A phobia is an intense fear. A paranoia is a delusion, something that's not real, and you create a fantasy about it. Like paranoia would be that you're afraid that people are out there to get you, even though nobody's out there to get you. A phobia is an intense fear of strangers or an intense fear of heights. So one is psychotic. The paranoia is psychotic. The phobia is not psychotic. It's what they used to call neurotic, but they're more disorders than neurotic. Is it possible to have anxiety, ADHD, and you're loaded if you have all of those? Let me take one at a time, all right? I'll take one at a time. I'm not going to talk about ADHD today because I've already talked about it. I'll give you some hints, but try not to get into it. We're still with phobias, and we are with phobias as well as with anxiety. Thought of psychedelics on treatment. Psychedelics, for example, things like ayahuasca and mescaline, psilocybin, and LSD. If some of them have really good results with post-traumatic stress disorder, but I have to overemphasize to be done always with professionals and where it's legal. There's some research that's going on now with ayahuasca and others that are actually trying to treat phobias and PTSD and things like that, and some are getting good results, but they're done with professionals. I would not advise you to do it without professionals, and I would not advise you to do it if you have psychotic tendencies because it could be very distracting and very depersonalizing. Okay, intrusive thoughts about someone out to get you. Let's wait till we get to OCD, and then I'll answer that. All right. I suffer from PTSD, OCD, major depressive disorder, and generalized anxiety. Damn, you got a lot going here. Let's look at it and see if maybe, talk to your professionals to see if maybe some of it is overdiagnosed or some of it is kind of redundant. But all of them can be treated with good professionals. All of them can be treated. So I'm going to move on now from anxiety and phobias to OCD. Okay. Up to a few years ago, obsessive-compulsive disorder was considered an anxiety disorder. It's no longer considered an anxiety disorder. The DSM-5 has it separate as OCD. Although OCD can cause anxiety, it's not an anxiety disorder, at least the way that it's being seen now. Obsessive-compulsive disorder needs to be broken down into the two parts. What is obsessive? Obsessive is intruding thoughts that disrupt your normal functioning. Thoughts. Compulsion are behaviors that are intrusive and disrupt your normal processing. And so an obsession would be, if you have a thought that bothers you for a while, that's no big deal. We all have that. But if you have a thought that interferes with your normal function, then it could be an obsessive process. And if you have an obsession and a compulsion obsession, you have an obsession about washing your hands, and then you go ahead and you wash your hands. That's obsessive compulsive. And what it does is it's done because it's a dysfunctional way of learning that by having the obsessive thoughts or by having the compulsive behavior, it reduces the anxiety, which it doesn't in the long run, but initially you feel like you have to do it. And then you develop some kind of thoughts. For example, if you have a compulsion that you have to, I had a patient who had a compulsion that before he left for work and he got his coat out of the hanger had to move 10 times. Otherwise, he was going to have something wrong happen to him. So he would just wait 10 times, 9 times, so it was 10 times. So see, that's very disruptive. That causes a big problem. So hello from Australia, welcome. And make sure that you follow and you let people know in Australia that we have a house shrink here. So obsessive compulsive, you can have obsessions without being compulsive, and you can have compulsions without being obsessive. Both are obsessive compulsive disorder. Some is treated with medication also as well, and that has to be decided by you and your doctor. Most of it is dealt with psychotherapy, biocognitive science, cognitive behavioral therapy, other techniques that are Gestalt, other techniques that are available, but they have to be done with a professional. Now, all of these things, anxiety, phobias, and obsessive compulsive disorder can be made less severe by working out, by meditating, by doing Tai Chi, by doing power walks, any kind of exercise that's repetitive, that increases your heart rate up and down so you can create human growth hormones is very good for it. What characteristics let you know if you have OCD? Well, if the question is, we all have at times a little compulsion. Sometimes we have a little obsession. A thought comes into your head and you can't get rid of it. And that's fine. It's no big deal. So you can't get overdiagnosed. But it's beginning to affect your normal functioning. That is so intrusive that it's beginning to affect your work. It's beginning to affect your sleep, your appetite, your interaction with people. Then it can be a disorder. What are your thoughts on SSRIs? I was been very hesitant to take them. SSRIs is a type of antidepressant that works specifically on serotonin, the reuptake of serotonin. That is something that needs to be discussed with your professional who you're working with. There are other ways to deal with depression. Some psychiatrists like to use SSRI, but there is some research now that is showing a brain syndrome with overuse of SSRIs. So you have to always be careful what you're putting into your body, and it has to be agreed with you and your practitioner, your professional practitioner. Some of that SSRI syndrome causes problems with memory, brain fog, concentration, but that's something that needs to be identified. There's a lot of research in Russia in that area, more than in the United States, of SSRI brain syndrome. So it's just following. Make sure that you do follow when you join. Jen, join and please follow. So now I've talked about anxiety, I talked about phobias, and I've talked about OCD. So what do intrusive thoughts feel like? It's a dialogue going in your head. It's like, for example, you have a thought, you have to pay the rent. Okay, that's good, you have to pay the rent. But you can't get, I gotta pay the rent, I gotta pay the rent, I gotta pay the rent. And it becomes obsessive, that's the word, it becomes excessive, and it begins to interfere. And then you notice, okay, I gotta pay the rent because I don't know if I'm gonna have the money, that's okay. But if then you drop the obsession of the rent and then it gets to something else, then you have a propensity for obsessive thoughts, and you need to look into it to get some help or to do some training yourself. You can read my books, but the books never replace professional help. Just be aware of that. They're an adjunct to professional help. So that's what it feels like. But don't get overdiagnosed, because we all have obsessive thoughts sometimes, especially if we're anticipating something. You have to go to the dentist, you think about it, and you think about it, and think about, well, nothing wrong with that. Who wants to go to the dentist? Once it's over, then the thoughts need to go. If you pick up on something else, and I got to go get some groceries, then you have to start paying attention to it because it might be too much. Can the thoughts be illogical? Yeah, because you see, obsessive-compulsive disorder has nothing to do with logic. It has to do with the secretion of thoughts as if they're coming out like donuts. And it usually has to do with decreased serotonin, which is one of the neurotransmitters. That's what antidepressants do. And also it has to do with an overactive interaction with nerve endings and so forth, the neurons. And GABA is very good for it. There is natural GABA you can take. There's some, but always do it with your professional talking. Don't do it on your own because I said it. But GABA can be increased with exercise, as I mentioned, Tai Chi, even some Qigong, some karate, and also some deep meditation and contemplation. It can be very helpful. Dance can be very good, and Gregorian chants can be really very good to decrease the brain activity. So those are some of the things that I'm talking about. So if you just join, I'm talking all about anxiety, phobias, and obsessive-compulsive disorder. And as I mentioned earlier, although obsessive-compulsive disorder can can cause anxiety, it's not considered an anxiety disorder. It's totally separate. Can I take ayahuasca? The spelling is kind of off, but I think you mean ayahuasca. To help, again, ayahuasca needs to be done with a professional. Don't go to a shaman somewhere and take whatever roots and things, and you're going to be ayahuasca, but you don't know the dosage, you don't know the quality of it, you don't know what that person is giving you. There are places in Costa Rica, for example, that is legal, and they do research, and they do ayahuasca with doctors, and they do it with shamans and doctors. So it's really very good. I did it once under supervision, and it didn't do very much for me. It's just no big deal, because I've done a lot of lucid dreaming, Tibetan lucid dreaming. You don't need any medication for that or any hallucinogens for that. And lucid dreaming is that when you're in a dream and you know you're dreaming, that's lucid dreaming. And you can learn to get out of the dream, you can learn to get into the dream, and unless you go into a space very similar to what the hallucinogens do, like ayahuasca, peyote, and all the others. So Tum is just follow the host. Very good. So make sure that you follow the host, because I need you to expand the audience so more people can have the benefits of this information. I'm a clinical psychologist, and I'm giving you educational information here to know what anxiety is, to know what phobias are, to know what OCD is, and to understand it. So then if you have to talk to a professional, you talk to a professional intelligently. Make sure that you're talking to professionals who are not arrogant and they tell you, you got to do this because I'm a professional. No, hell of that. No, you're a consumer. Ask questions. If they're not willing to answer your questions to your satisfaction, guess what? Go out another professional. Because a professional has a responsibility to inform the patient. It's called informed consent. It's very important, and it's very ethical to explain that. But there's some professionals who are as screwed up as some patients. So they get arrogant, they get egocentric, and find somebody else. Find people that are willing to teach you and to work with you and to respect your feelings and your thoughts. That's the kind of people that you need. You've had dreams like that. Yeah, it's lucid dreaming, it's called. And the Tibetans teach you how to navigate. I had a Tibetan Lama teacher who taught me how to navigate the lucid dreams. That's why ayahuasca didn't do anything for me. I have anxiety while driving. I have to cross bridges. What can I do? Well, there's some techniques. Read my books. But some of the things you can do is go back. You sit yourself comfortably and go back and think of when did this first happen? And in your mind, what you do is you create it and bring in the anxiety that you feel. Breathe, let it pass, and go back and forth, back and forth. That's a desensitization technique. I have a lot of information in my book, especially in the Mind-Body Code, but both Mind-Body Code and Mind-Body Self. But this is not to replace professional help if you need it. It's always in addition to professional help. But it can be treated. These things are learned, and anything that you learn can be unlearned, very much. But there is some genetic predisposition for some people, but it doesn't mean that it's a genetic sentence. It's only the predisposition. Persistent dizziness, that could be many things. That could be inner ears, it could be the occipital, it could be anxiety. That's something that I can't answer because you require some assessment and some diagnostics and then see what that would do. But certainly, especially panic attacks can cause dizziness if you have panic attacks. And that is one of the, panic attacks are one of the anxiety disorders. What are my thoughts on EDMR? I think it's very good. There's a lot of research with, that's eye motor desensitization, but by itself is not sufficient. I think you need to do that and get additional training in how you learned what happened to you. Was it from a trauma? Was it from obsessive compulsiveness? Was it from anxiety? Was it from a phobia? So EDMR is good as an adjunct. I've had millions of tests. Well, for what? What have you had millions of tests for? Maybe too many tests and not enough treatment, right? Or not enough tools, maybe. Sometimes that happens. So if you just joined, I'm talking about anxiety, phobias, panic attacks, obsessive-compulsive disorder. Panic attacks are terrible. A panic attack is a particular type of phobia, but it is a terrible thing for a person to have that. You think you're going to die, your heart races, you have chest pain. Sometimes it feels like you're having a heart attack, and it's not, it's a panic attack. This is why you need to have a professional treat it and see if it's a heart or if it's a panic attack. Nobody dies of a panic attack, but you have to find out if it's a heart. But it's one of the worst things that can happen. It's very, very scary, and it can be treated with medication as long as with psychotherapy. But again, medication does not cure any of those things. It helps it. The cure comes from psychotherapy, from working with the individual and finding out what the cause was and how to relearn it. You have panic attacks, they can be very debilitating. They're very debilitating. But get some help for it. Get some help because there's good prognosis for it. Find out what triggers it. And you also, with panic attacks, you always have a little bit of a precursor. You begin to get a feeling that something's going to happen. At that time, stop and do some deep breathing as if you're breathing from your heart. And that, in many cases, will stop it. Don't think, feel. Feel your breathing, relax your body. And if you catch it early, it'll break the chain into the panic attack. But this does not replace professional help. Okay, we got a clown warning here for somebody that's probably going to be blocked because they're trying to be cute. When you're trying to be cute, what happens is that, do you like Wim Hof? Okay, that's a legitimate question. Wim Hof is what they call the Iceman. This guy goes into frozen lakes under the water, and it's amazing. And what they found is that he's very resilient, but he has more brown fat than other people, like seals and whales. Brown fat is the type of fat that has a protection. It keeps the heat better than if you don't. But this guy is incredible. This guy is really, really incredible. And he's been tested, and he's in very excellent shape. I think he's in his 60s, but he does all kinds of wonderful things. I don't want to do the Wim Hof. That I can leave that to him and other people. I'm not interested in that kind of exposure to cold weather. I'm from Miami, so that wouldn't work for me. He has workshops, by the way. Wim Hof has that he'll take you to places and freeze your gluteus maximus. So if you want to do that, I'm sure it'll be good. But make sure you always check with your doctor and get medical approval. Attacks multiple times a day. Well, are you getting help? You need to get some help. And there's good therapy for that. Very good therapy. Find out where it came from, because they start somewhere. They don't come out of sometimes from an accident and something that happens, some abuse, something that you saw. Sometimes it's called vicarious panic attack, which means that you have a panic attack from having seen someone who had a traumatic experience, like seeing somebody in an accident or seeing someone. This is why it's not good to watch gory kinds of films, especially when you're eating, because it'll mess up your stomach, and it's a good way to learn gastric kinds of problems, gastrointestinal kinds of problems. What if you came from abuse? How do you get from it? Read my books. I do a lot of talk about in my books from abuse, and the 3 archetypal wounds that I call from abuse: the mind-body code, the mind-body self. Very, very good books. You can get them at Amazon. Not many people know the difference between panic and anxiety attacks. That's right. Panic attack is a lot more intense, and it's different. It's just much more intense, and it has an etiology or a cause that's a little different. But the more you learn, education will help you become a more instructed and aware patient, if you're going to be a patient for somebody. And it'll allow you to ask very important and intelligent questions, so that then you can decide what you want to do with your body, because it's your body. It's not the doctor's body, it's your body. So you need doctors that understand that you have questions about your body, because you don't want to put anything that they tell you just because of the hell of it. Because otherwise, oh, oops, I gave you the wrong medication. Well, no, there's got to be informed consent. It's very important. Yes, panic attacks are very debilitating, but they can be treated. You can get help and they can be treated. And it requires physical activity as well as psychotherapy and sometimes medication, depending on what your professional mental health person is doing. Okay, good. But let's just make sure that we stay on target here so that the people that are coming in that are being kind enough to spend time with me, that we don't distract them with silly things and things that have nothing to do with the subject. Neurodiversity and neurotypicals. I don't know what you mean by that, so just tell. That's okay, Maximus. You're all right. Fine. Tell me what it is, and then I'll tell you what you're talking about. I'm a neuropsychologist, so I could probably tell you what it is. I just don't know what neurotypicals or neurodiverse. There's a therapy coming out every day, so I don't keep up with it. I keep up with what I know and what I know that works. Every once in a while, people come up, I'm going to do tapping, I'm going to do this, I'm going to do that, and some of them are not really good science. So welcome. And we have here rehabilitated clowns and rehabilitated vampires. People who started as clowns and they said, hey, look, I don't want to waste your time and my time. I'm rehabilitated now. So they start asking intelligent questions and they come out of clownhood. Attention deficit disorder. Yeah, those are just little labels. There's attention deficit disorder with or without hyperactivity. I have videos on that, so watch those. And they it's not an illness. I don't see it as an illness. I've written professional articles. It's a dysfunction. It's a psychosocial dysfunction that has some genetic components, dopamine and all that, but it's really an abundance of curiosity rather than the deficit of attention. Abundance, curiosity that needs to be treated, but it's not a disorder. It's something that needs to be treated without calling it something sick, because it's not. What do I think of tapping? I don't think very much of tapping. You ask me, I'll tell you. Have been a lot of research on it? Yes, bad research, bad designs, and I'll tell you an example about tapping. And by the way, it has a lot of placebo effects. So if it works for you, it's great. It's great. I'm not, but as a science, it's questionable. Number one, because it says that it goes with meridians. It doesn't go with any meridians. Also, that there's some Canadian studies that have been done that actually looked at, and it was a really good study, because they had the good control. They had a control that they did nothing. They had a control that did the actual tapping. And they had another group that had a tapping to a doll. You were tapping a doll. And both groups did as well. So what does that mean? Placebo. So that's what I think about it. Recurring bad dreams, is that normal? It can be normal because we all have recurring bad dreams. What it means is that something is unresolved in your life and you can get some therapy, or you can read my books about that too. Mind, Body Code, Mind, Body, Self. I talk about the general person. So if you have a bad dream, you can see a therapist and they can help you do interpretations of the dream, and they can help you lucid dreaming if they know about lucid dreaming. So that's a way of solving a lot of those things. You just need the tools to be able to do the right job. You need tools. It's not that you're dumb. You're lacking tools. Everybody here is intelligent, otherwise you wouldn't be here. So I'm asking you to make sure that you follow the host, and that tomorrow this will be available to you on my YouTube channel, which I want you to follow also if you go there, and it's Dr. Mario Martinez. That's it. And if you've already following here, share this video with your social media, because other people have access to it. And you'll know that if you follow, then you'll know that I'm coming on, and then you can decide if you want to watch it or not. And then you'll know that the next day it'll be available. Why does a person get relief after compulsion? Well, you don't get a lot of relief. What happens, you get the sense of relief. It's like when a person is very anxious and they have a cigarette and they go, okay, I'm relaxing. They're not relaxing. It's just a psychological sense of relaxing. Nicotine will speed up your heart, but you have a sense that you're relaxing. So in some cases, compulsion, like for example, people that are so, these are self-injurious behavior, that's a disorder, and they mutilate themselves to reduce the anxiety, which is a bad way to do it. It doesn't work. It might work for a few minutes, but then you have to do it again. So it's a something builds up and you feel like you have some relief. Some people will hit a wall or something. That's not good. But it feels like you're relieving it because it's building up and it's a mechanical thing. So that's not a good way to relieve anxiety. Any PMDD and anxiety, anything that causes anxiety, you have to look at the source of the anxiety, whatever it is. And then you have to look at how you learned it and how you can unlearn it. In my books, I talk about that. And the reason I'm mentioning my books is because it's all there. I put a lot of time into those books. And it's the Mind Body Code, the Mind Body Self. They're both bestsellers. And you can get them on Amazon, at Amazon. They're the best price. Lucid dreaming just happens in that moment between not sleeping and the moment when falling asleep. What you can have lucid dreaming is a hypnagogic and a hypnopompic. Before you go to sleep, you go into almost a never land dream state, and you can have lucid dreaming. Or just before you wake up, you can even have hallucinations, which is normal. Salvador Dali, the surrealist painter, used that. He used the hypnopompic and hypnagogic experiences to do all of his surrealistic painting. So he applied that. Everyone has anxiety. No, not everyone has anxiety. You have anxiety when you need it. If it's not dysfunctional, it's normal to have anxiety about something that could be dangerous or something that you don't know about. For example, you're going to have a test and you don't know if you're comfortable with all the information that you learn. That's anxiety. That's normal. But if you have anxiety all the time, or if you have anxiety about many things in your life, then that is not good. That's not normal anxiety. And you can do whatever you want in lucid dreaming. Yeah, and you also learn how to come out of lucid dreamings. If you're having a lucid dream, you can learn to come out of the lucid dream when you don't want to be there anymore. But in lucid dreamings, you can, since you have control, you can try out new things in the dream rather than the dream controlling you. So it's almost like taking a hallucinogen without having the side effects or the possible problems of hallucinogens. No, not everybody has lucid dreamings. It doesn't happen to everybody. The people that have lucid dreamings, they think that everybody has them, but they don't. It's really a good thing, actually. Children have more lucid dreamings because they live more in theta waves. Theta waves it's almost like a mystical state that you believe anything you're told, and you have fantasies. That's why children have fantasy playmates, and they make up stories. That's theta, because you're testing the world. Then as you get pre-adolescent and adolescent, you go into beta, and you begin to question everything. So that's part of the reason. And when you go into deep, especially contemplative meditation, you can go into theta waves, and that's why you can learn so well. Theta, you learn information very well. It's similar to hypnosis, but it's not hypnosis. You can have sleep paralysis, and here's what happens with sleep paralysis. Our bodies normally, when we're going to sleep, will cause a certain kind of paralysis, so you don't live out the dream. Otherwise, you'll be kicking and hitting. But if you just happen to wake up under that paralysis, you wake up and you can't move, and it's okay. When that happens, stop and say, okay, this is a paralysis state. Let me relax, and I'll come out of it, and you do. But that's what happens. If you get all uptight about it, it takes longer because the anxiety makes it worse. That kind of paralysis is normal when it happens. If it happens too much, then I think you need to check it out. But it's usually normal because you woke up just under the paralysis state. And you notice that dogs sometimes they'll bark or they'll kick. They're not in the paralysis. So they're playing out the dream. So that's why you have to have that paralysis, so you don't play out the dream and kick and hit and do all these other things. You play it out in your head without the body. But if you wake up, just happen to wake up during the paralysis state, then you can't move, and it scares the hell out of you. So, okay, more questions. If you just joined, I'm talking about anxiety, phobias, and also OCD and panic attacks. So let me stop here and see if you have any legitimate questions, not specific things that I could do treatment, but general questions so I can inform you more about these things, and maybe if you're seeing a professional, to ask the right questions. So if you just joined, make sure that you are following and that Dave just joined. Dave, make sure you follow and you share so that other people can have access to it. A lot of people are joining today, so I have quite a few people. And what I'm asking you to do is just to make sure that you follow if you haven't followed yet. And if you have, then share these videos. It's important that they go organic, because we have more people then. Also, Mental Health Warrior just shared the video. Wonderful. Thank you. And I'm glad you're here, because that way other people can take advantage of this. They're getting free information here, free scientific information of what things are from the psychological, neuropsychological point of view, and always giving you good news that all of these things can be treated. And there's very good prognosis for most of them, including panic attacks. It's a good prognosis for it if you get the right treatment. So this is about good news, how science can be hopeful and can be helpful to you. But there's some pseudoscience out there. There's a lot of crap out there that's not science. And when people are desperate, they're more prone to that because they're desperate. They've tried everything and they want a quick fix because they're hurting so much. That's when they become very vulnerable to the charlatans out there. So there's some charlatans and there's some good people. So make sure that you learn to discern. And the whole idea about all these presentations that I do is to teach you what good science is and what charlatanism is, so that you can tell the difference. There are people that they were cured because they drank sugared water for 10 days and then they think sugar water is good. Well, no, there's no science there. Some other things were going on and they attribute it to sugar water or whatever. So be sure that you follow, and that when you try to follow something, you check it out and find out if it's really good science, if it's something that somebody just made up and it worked for them. So it's very important that you do that. Okay, so people are, Cassandra, the new people that are joining, make sure that you follow the host. That's the first thing that I ask you to do. And second, of course, enjoy, and then share the video. Share it with other people. And if you want to see the whole thing, it'll be available tomorrow on my YouTube channel under Dr. Mario Martinez. You can go to my page here on House Shrink. That's my name here. I'm Dr. Martinez, but House Shrink. And you can see there my website. You can go to my website, and I have many, many free articles and audios and videos, as well as my books and other things that are available. So there's no excuse. There's a lot of information out there that I put out to provide information for those of you who are interested, who are seriously interested in learning and becoming a better person. That's what it's all about. All right, we're coming to an end, and I'm letting you now ask questions specifically about phobias, anxieties, OCD, panic attacks, and what can be done about it, and seeking professional help. So if you just joined, this is Dr. Mario Martinez, House Shrink, and I am giving you information about phobias and anxiety and so forth. And then you can watch this whole video tomorrow on my YouTube channel, which is Dr. Mario Martinez. And it'll be on tomorrow. I have about 200 videos on YouTube that you can go on, all kinds of information. Self-esteem, relationships, pronouns, all kinds of things. Some are a little controversial, but that's how it is. Science, you have to have a backbone to talk about it. Not to criticize anyone, but just to give them the consequences of what they're doing. So Avra Thomas, just follow the host. Thank you very much. Nafatina just joined. So whoever just joined, make sure you follow the host. If you haven't yet, go ahead and follow the host, and you'll be able to then be you'll know if I'm on, and then you can decide, hey, I want to listen to this. But at the same time, you'll know that if you don't have time to watch it, you know that it'll be on the next day on YouTube. So that's the way it goes. All right, a few more questions and then I'll be gone. You can then follow my work and get more information. Interested, get the books. I think you'll find them very helpful. The Mind Body Code, the Mind Body Self. I would start with the Mind Body Code first, and then if you find it helpful, then go to the Mind Body Self. But you can get either one. You can start with either one. They're independent. It's just that one has more information on mind-body communication, and the second about mind-body communication in cultural settings. Okay, we got let's see, a clown warning here, oh, you're gone. You see how interesting it is that you got to have the clowns. They just got to come in and distract because they can't take themselves seriously. So therefore, they can't take the world serious. That's what happens. So clowns are we only accept rehabilitated clowns, not active clowns. They can go play somewhere else. And if you want to be a clown, go to the circus or join some of the places that pay a lot of money. That go to Saturday Night Live or go to some places where you can get paid for it. But don't do it here because it's here you're just distracting people. It's not working. All right. So any legitimate, intelligent, legitimate questions, I will accept them. So please go ahead. Can you have OCD with poor insight? Well, insight and OCD don't necessarily go together. I mean, you can have insight and you can still have OCD because it's a neurological reaction to something, a neuropsychological reaction. And sometimes the insight doesn't work because it's just intellectual. Insight will be, look, I'm a good person. I relax and I meditate and I have OCD. That's insight, but it doesn't help it because it has to be dealt with at a mind-body level, not just intellectual. Insights are good, but action is very important. Any other questions here? About your daughter, she believes she has what? BPS? What's BPS? Abbreviations are, tell me what it is and then I'll see if I can talk to you about it. Yeah, tell me about what is BPS, BPD or BPD. Okay, that little statement meant nothing. I don't know what you mean by that, if you're talking to me or someone else. But if you just join, then it's about anxiety, phobias, panic attacks, and OCD. So anyway, make sure that you're serious here so that you can respect the people that are here. No matter how much I talk about it, we have people that kind of test the limits because that's all they can do. That's all they focus on. They have to be either screw up your day or be a clown so that they can distract people who are interested and who are serious and who are hurting. Some people are hurting here and you're wanting to get some help, and then these people come in and they borderline personality disorder, that's another topic. That I'm not going to talk about because it's a whole topic, and sometime I'll talk about that. But I have some videos, I think, on that, so you can go ahead and go to my YouTube channel, Dr. Mario Martinez. Borderline personality disorder is a very serious problem, and sometime I'll talk about it, but not here. Oh, thanks for your patience. Yeah, in my field, I have to be very patient. And sometimes I laugh. I mean, I don't get angry. Just that I say, hey, look, you want to waste my time, go somewhere else. This is why we have this monitor. Samantha does the moderating, and she does a great job. And sometimes she'll answer questions that I don't get a chance to. And she's trained. She's a diplomat in biocognitive science, and she has an instructorship, so she can actually answer some of the questions that I may be missing. But nobody else, because they're not authorized to do that, because otherwise you'll be giving the wrong information. Okay. You have been good. Thank you. Spiral Flower, thank you so much. We have a lot of good people here. 99.9% of the people here are good, and the others are goofy. So it's okay. But the problem is that they distract you, and then they drain me. So that's why I tell people that they have a clown warning. If you just join, I have been talking about extensively phobias, OCD, panic attacks, and anxiety. But if you just missed it, it's okay because it'll be on tomorrow in full, completely, on my YouTube channel, Dr. Mario Martinez. So what I'm doing here is I'm creating a subculture of wellness, of good, intelligent, serious people who want to grow and want to learn. And that's what I'm developing here slowly. Getting more, thousands of people are joining. We have close to 11,000 likes, and it's moving up really. It's close to 4,000 following. We need the following to go up to 10,000, because in 10,000 I can do much more. For example, now because of the following, I can do these extensive videos. If you don't have that level of followings, they'll only let you do 60 seconds. So because of your participation, I have more to offer to you. And when I get to 10,000, I can do even more. So make sure that you follow. You'll let your friends know about it and tell them, there's this guy here who comes up with these incredible things. He's very patient and he knows what the hell he's talking about. Why don't you listen to him? Okay, so, oh, somebody share. Oh, yeah, Susan Starr, just share the video. Thank you so much. Okay, every time I'm getting ready to go, people come up with questions. So you kind of get me hooked and you know me very well now. But I'm going to have to leave in a few minutes. So if you have more questions, go ahead, please, and I'll try to. Yeah, you shared the video. Thank you, Susan. That's very nice. Parker78 just joined. Parker, make sure that you follow and you share the video. Very important. And I've been talking about phobias. I've been talking about panic attacks, OCD, and anxiety, generalized anxiety. So to bring it together, anxieties are normal if it's a functional anxiety. Something dangerous out there, something that worries you for a period of time, fine. But if it takes over your life and you're anxious about many things and you're not able to live a peaceful life, then that becomes a disorder and you need help with that. Panic attacks are terrible. It's an excessive response to anxiety. An anxiety attack is a little different. Panic attack is worse. And you think that you're going to be dying and heart rate, palpitations, all kinds of things. And it can be treated. And it has really good prognosis. OCD is not part of the anxiety disorders. It used to be. Obsessive-Compulsive Disorder causes anxiety, but it's not an anxiety disorder anymore, according to the Bible, the DSM-5. And I agree, it's not an anxiety disorder. It's an obsession and a compulsion. Obsession has to do with excessive thoughts that interfere with your normal living. And compulsion is a behavior that interferes, it intrudes. And if you have both, intrusive thoughts, intrusive behavior, it's obsessive-compulsive disorder. So that's where it comes from. So don't say this guy is obsessed with this if it's not really a clinical obsession. Just use the words clinically. Or somebody's addicted to television. Unless you swallow a television, you can't be addicted to it. You're compulsive to a television or compulsive to porno or whatever. But addictions are something different that I've talked about many, many times. So thank you for sharing. Thank you for following. And I want to really, really thank you for being here. A really good audience. A lot of people showed up. We'll have several thousand today. And then tomorrow, you can go to my YouTube channel. You can go today, too. There are other things there. There are about 200 videos, free, on many, many subjects. And that I think will be very helpful to you. And, of course, my books, which The Mind, Body Code, The Mind, Body Self. You can get them at Amazon. And I'm getting roses here from people. Thank you very much. And I'm very glad you were here. And I'm very glad that all of you hopefully got something out of this. So enjoy, have a wonderful day, and remember, celebrate how wonderful you are, celebrate you have a purpose here in life, and that you're excellent, and let people know how excellent you are by your actions. And don't use no problem when somebody says thank you. You're welcome. My pleasure. No problem psycholinguistic is saying, hey, I just avoided a problem. I have just avoided a potential problem. Walking on eggshells. Talking about anxiety, language is very important. So don't say no problem, just say thank you. My pleasure. All right? So no problem is out. Get that out. And because you have an opportunity for gratitude. When somebody says, oh, thank you, you've done such a good job. No problem. Wait a minute. Here's an opportunity for gratitude. Oh, thank you. I appreciate that. It was my pleasure. The psychoneuroimmunology of the gratitude is very different than no problem, because the brain goes, no problem? Where the hell's the problem? Okay? So remember, and I'm so glad, how do you find your purpose in life? Things that make you feel good about yourself, things that give you a sense in your journey. And I'll be talking about, I've talked about eudaimonia, which is pleasure with purpose and meaning and service. I have a whole video on that, so go to that. But you find purpose usually when you have a gift. You're good with creative things, you're good with carpentry or the work that you do, and you wake up in the morning and there's a purpose. If you wake up in the morning and go, oh God, another day, you got to find purpose. And I have videos on that, so go to my YouTube channel, Dr. Mario Martinez, and look them up. All kinds of things there. All right, so enjoy, And again, have a wonderful day, and remember how wonderful you are. And the clowns, you're welcome back next time if you want to be a rehabilitated clown. And the vampire is the same. If you want a rehabilitated vampire, fine. Enjoy and have a great day. I had a good time. Bye-bye.